Good afternoon, everyone. Bonjour à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. My name is Kina Leclerc, and I will be your moderator. Je m'appelle Kina Leclerc, et je serai
I am Kina Leclerc, and I will be your moderator.
To begin, a quick reminder to place your phone on mute until I invite you to ask your question. And please do not place the call on hold. Available for questions from the media, we have disponible pour répondre.
Available for questions from the media, we have now
Mayor, le maire, Jim Watson, Steve Kanellakos, City Manager, Directeur Municipal, and Anthony DiMonte, General Manager of Emergency and Protective Services, Directeur Général des Services de Protection et d'Urgence. Phoning in today, we also have Councillor Keith Egli, Chair, Ottawa Public Health Board, le conseiller Keith Egli, Président du Conseil de Santé d'Ottawa, la docteure VERA ETCHES, Medical Officer of Health, médecin-chef en santé publique, and Wendy Stephenson, Chief Financial Officer, Chef des Finances. I will now invite each agency to ask their question. You may ask one question with one follow-up.
I will follow by alphabetical order. I will invite each agency to ask a question and with a follow-up.
For the reason we lose you during the call, please try phoning in again or contact Media Relations to submit your question. So we will now start with, nous allons maintenant commencer par Kate Porter at CBC Ottawa.
Hi there, everybody. My question is for Dr. Etches. We understand there'll be a news conference at 3:15, and it's to do with paid sick leave. I was wondering, if you could speak to the need for paid sick leave and what might be, the least you might hope from a move from the provincial government.
It's very encouraging that people are exploring the options for paid sick leave because we have identified that there are people facing an impossible choice when they have a minor symptom like a headache or a sore throat, whether to go to work where there could be potential transmission, it could be COVID, or to stay home and not be able to pay rent or buy groceries. So the idea is that we need to make it possible for people to be able to stay home when they have those symptoms, to be able to go to get tested, make sure it's not COVID, and decrease transmission in workplaces.
And my second question is for you as well. The chart is nicely showing that case counts are coming down a little bit. I'm wondering at what point you would say the numbers signal that we should head back to a regional approach to restrictions.
are encouraged, and I want to thank again the people of Ottawa for doing this hard work of staying home, of running their businesses through curbside. You know, there's real challenge that people are experiencing right now to get to this point, but what people are doing is working to stabilize the COVID situation. We do see the rates coming down, but we also know people aren't getting tested as much. So the picture I've been wanting to see is that the hospitalizations would also stabilize, and it does look like that's happening. The hospitalizations are fairly stable. So encouraging, you know, people should be, you know, supported to continue these measures, because we aren't yet seeing the drop to the kinds of levels where, you know, we had things open after the surge, for instance, in January. We're still almost at the same high rates that we saw at the peak in January. So we need to continue to bring the levels down so that we can get schools open, for instance, as the first thing that we want to see. And whether that should be done on a regional approach is, I think, an active conversation. We've seen over the course of the pandemic how connected we all are. Right now, the very high hospitalizations in the Greater Toronto area are having an impact on what our hospitals can do here as they take people on transfers from the GTA. So all said, it's a bit too early to be talking about any lifting of restrictions, but it will come, and we're thinking ahead, you know, particularly around when can we open schools again.
Thank you.
Thank you very much. We will now go to Eric O'Brien at City News Ottawa. Eric, are you on the line?
Yeah, can you hear me?
Yes, we can hear you.
Okay, my mic was super low. This question is for Mayor Watson. Just to kind of put a point on the Menard motion a while ago. I understand, you know, why council voted unanimously on it, but just maybe get your take on the need to emphasize paid sick days today, and especially prior to the government's announcement later today.
Yeah, actually, there was one dissenter. Councillor Shirelli dissented on the motion. I think a couple of things. First of all, there was more broad-based support for this motion for a couple of reasons. First of all, there was the understanding, explicit understanding, that the funding for paid sick leaves during a pandemic should be the responsibility of not the small business owner, but the provincial government. Clearly, small business has suffered tremendously, and they're on the ropes financially and mentally and physically. And it was important that I think members of council saw that there was some appreciation that we need paid sick days, but it should not come out of the small business person's pocket, for the simple reason that they are suffering, and many have already gone out of business, unfortunately. And then secondly, Councillor El Shantiri and Councillor Dudas brought forward a very good direction that there be greater consultation with the business groups, like the small business BIAs, the Regroupement des gens d'affaires, with the Francophone Business Group and the Board of Trade, because they're the ones that are going to have to implement any decision by the provincial government. So we remain optimistic that the province will announce later today, I believe, at 3 or 3:15, a plan that would see paid sick days during a pandemic, but that the funding for that come from the upper levels of government and not from the small business women and men. Thank you.
Thank you. I think maybe a follow-up to that, just to get a little bit more of a sense of what's next. You kind of, I think you mentioned it there, but during council you said, maybe I just missed it, but that staff would be making a report on this. Maybe staff can give me an answer of what that's going to be looking like.
Yeah, the undertaking is that when the consultation with the BIAs and the Labour Council and the Board of Trade and the RGA all takes place, that the findings of that consultation will be shared with members of council and the public. So we hope that our staff would go out over the course of the next week to 10 days to 2 weeks, consult the BIAs, consult the small business entrepreneurs, and report back, and we would share that information with the MPPs and members of Parliament. Thank you.
Thank you.
Thank you very much. We will now be going to Ted Raymond at CTV Ottawa.
Good afternoon. My first question is to Mr. DeMonte, just regarding the vaccine rollout locally. We've got just over a third, I believe, of everyone who is eligible has at least one dose. Where are we in terms of the track to have first doses in as many arms as possible by this summer?
Thank you for the question. I think we're in a very good position. Our operations continue at full steam and as well. And I think this is very important to point out. Our strategy that we're doing to getting to priority neighborhoods is extremely important, and that's going well. We're actually expanding it over the next little while. So yeah, we're somewhere in the neighborhood of 35% of the eligible population currently has gotten their first dose. So I think we're well on our way to continue. And I think your question is directly, will we get everybody a first dose by that period of time, which is what different levels of government have announced. As my answer is always, we've got the capacity to do it. We've got the infrastructure to do it. It really depends on vaccine availability. As you know, we had a little glitch over the last little while. Moderna, there was a delay, and some diminished Pfizer. But we're hearing positively that in the next few weeks that should pick up, and we'll start seeing more vaccine arrive. So I'm still very optimistic.
Okay.
Oui, en français.
Our vaccination campaign is ongoing. It's working well. We do believe being able to vaccinate everyone before the summer, the first dose, as long as we receive the doses. We have the capacity, we have the personnel. We can work very efficiently. I'm very optimistic. If we continue receiving the doses, as we mentioned, we might actually have more doses available than people to vaccinate. Thank you so much.
It's also to you, Mr. DeMonte. Just regarding the shipments and the supplies of vaccines coming to Ottawa, have you heard or do you know if Ottawa will be receiving any of the Johnson & Johnson vaccine that was approved and how that will change or alter the process for vaccinating in Ottawa? It's a one and done. So what if we get any, what is the plan for that one?
Yeah, so the team and more importantly the sequencing and scientific group here led by Dr. ETCHES and her team are looking at where that vaccine would be most effective and then we'll deploy it there. But directly to your question, we haven't heard when, how much, and if we're getting it. I'm assuming we will. It'll be another tool for us, but that's still yet to come. We're still focused on receiving our Pfizer, our Moderna, and as you know, the AstraZeneca for both pharmacies and the physicians' offices. So that's the tools that we currently have. But when we do know that, the team is looking at how that can be most targeted and most effective tool to use, and we'll certainly let you know there, but it's a little premature to give you that information now.
Thank you.
Thank you very much. We will now be going to Craig Lord at Global News Ottawa.
Thank you. This would be for Anthony DeMonte, I believe. Yesterday we saw a new Section 22 order come into effect affecting gyms and indoor fitness facilities. Wondering if there have been any new charges or tickets handed out by bylaw under the new powers for any potential violators there.
So thank you for the question. This is a tool that we had identified some of the proprietaries, some of the owners of these businesses weren't complying and were creating an environment where there was a public health risk. Dr. ETCHES and her team looked at that, created a Section 22 order, which gives us additional tools to be able to enforce and ensure that these businesses comply with our public health measures. orders. The process for that, the Section 22 was signed by Dr. ETCHES, so the first day what we do is we go to each of the businesses, give them the Section 22 order so they can see it. We spend some time with them to educate them and explain to what it means so they have time to ask questions. So that was done yesterday. And today, the officers will be visiting, and we suspect and hope that they comply. Otherwise, we will charge. But to date, there have been no charges as we speak. And what we have seen is some movement towards compliance and some adjustment. And we want to give them that data to absorb the information, ask any questions they may have. But we won't tolerate anything that won't respect the Section 22 orders. So the next few days, you can perhaps ask me that question. And unfortunately, if there's people that don't respect it, there will be charges.
Thank you. And follow up to you as well. I think you mentioned there that the rollout in priority neighborhoods is going very well and that you're looking to expand it. Will there be additional neighborhoods named in the near future, and what will that expansion look like?
No, as you remember, the neighborhoods had been identified early on, and we've been working. So there's the 21 high priority neighborhoods, and there's the 3 postal codes as well too. So there's not going to be additional. What we're doing is looking, and the team is being really innovative with regards to approaches and how we get in there, different models, knocking on doors, setting up pop-ups, working with community partners in all those communities. Which is extremely important, as well as faith communities as well too. So we're looking at all sorts of strategies to get into those communities and vaccinate as many people as we can. So it's more that we're doing, and as that continues, we're allocating more and more vaccine to those 21 neighborhoods so we can accelerate those high-risk areas, because those it's extremely important that we don't lose sight that these are the people that have been the most affected, and that the team has to continue to focus on that. And Dr. ETCHES has been really clear, and the data that she's provided and the leadership she's provided to the EOC really motivates the team to achieve those goals.
Thank you.
Thank you very much. Nous allons maintenant...
We'll now give the floor to Julien Paquette from Le Droit. Please go ahead. I do understand that Mr. Chapman is not participating on the call, isn't it? He's not. I had a question about the application of the new bylaw about short-term rentals. Maybe Anthony DeMonte can answer, or the mayor can answer. We heard Councillor Moffat talk about the impact it could have on larger dwellings. I mean, for large families visiting. Do you have a little bit of leeway? Let's say a family with 6 children looking for a 1 weekend rental. And let's say that these children are with some friends and you have 12 children. Could it be allowed? Would that be an exception? The answer is no. We made a compromise with a maximum of 10 occupants in one dwelling, one residential dwelling. The majority in the council do believe it's reasonable to have 10 occupants in one dwelling, but not 35, such as a hockey team or a soccer team. When you live in a residential neighborhood, I think that everyone supported this motion, this compromise today that was proposed by Councillor Eglai to move from 8 to a maximum of 10 occupants. This would be more reasonable. Thank you. Follow-up question for Dr. ETCHES. You mentioned in English earlier today that you may propose some adjustment to the sanitary measures. I understand that this is not the time right now. We saw the impact of the different variants. What will be your approach in reopening small businesses? When the situation is stabilized, do you think we're going to be a little bit more cautious than before? Thank you so much for your question. It is very important to avoid another increase of cases within the communities. You're right. We have to move slowly. Look at the number of cases that we have within the community right now, and do take into account those variants. I think we have more cases right now than in January. The first question that we will ask ourselves is, can we open schools again? At the beginning of the year, we had up to 40 cases per 1,000 inhabitants. Right now, we have about 100 cases per 100,000 inhabitants. So I would like to thank the Ottawa population because the measures in place are working. It is clear that the number of hospitalizations are now stable. We're looking at other variables also. The whole of the province of Ontario is interconnected. We see that the situation in Toronto is very serious. And this is impacting our hospitals here within the City of Ottawa. That's the reason why we have to maintain open channels with the province to tackle this situation. Thank you so much. Thank you.
Going to John Willing at the Ottawa Citizen.
Thanks, Tina. A question just following up from a couple weeks ago regarding the parks. I'm wondering if there's been any parks that have had their operating hours adjusted, and if there's been cases when staff recommended to counselors a park get reduced hours, but counselors refused. Maybe that's for the city manager or for Dan Cheney if he's on the line.
Yeah, I think, is Dan Chenier there or Tony? I know, for instance, Councillor Harder's ward, I believe Councillor Meehan, and I believe Councillor Gower.
Yeah, it's wards 3, 22, and one park in Ward 5 have a 9 a.m. Closing time, and there was
9 p.m.
9 p.m. That's right, closing time. And there was one sign that went up at Brewer Park, but that was a mistake that one of our workers put up, so that was taken down almost immediately. But those are the 3 wards where we've had modified hours.
Okay, thanks, Mr. Kanellakis. A question for Dr. Etches. I'm wondering if your team has done any more surveying of the public about vaccine hesitancy, and what's your level of satisfaction right now about the uptake of the vaccine options?
Thank you. We have surveyed the population in Ottawa using a representative survey, and we've looked at intention to get the vaccine across different age groups. It's very high. The majority of people intend to get the vaccine, over 75%, I believe, and much higher, close to 100% in the older age groups. And this has been borne out in our experience. So our experience is that vaccine hesitancy is not a limiting factor here in providing protection to people with the COVID vaccine. The limiting factor is access to vaccine. So we see, for example, well into the 80s in terms of percent coverage when populations have had access. So they're 70s, 80s, and 90s plus. And now we're making, again, that progress towards at least the minimum goal we're trying to reach for every age group of 75%. That's coming along for people in their 60s. So this is important. Older adults above 60, also above 50, are contributing to most of the hospitalizations and death. And so really pleased that the community is seeing the value of vaccination, and we do have high uptake.
Thanks, Doctor. Can I
just, John, since you didn't ask me a question, I'm just going to take a moment, just because it's on the issue of vaccines. If I could plead with members of the public, please do not go out and register 5, 10, 15 times with different pharmacies. It's clogging up the system. The system, a lot of people find, is very frustrating at this point because there are different ways based on the different pharmacies how you get registered and whether you get notified in a wait list or so on. But far too many people are reporting back to me that they have individual friends who are booking one case in Manotick, 18 different pharmacies. And what ends up happening is sometimes it's very difficult to cancel those appointments, and then that's a wasted opportunity for someone to get vaccinated. As well, you're leaving an empty spot for someone who could be vaccinated, but you're on 18 or 15 different lists. So I'd encourage people to please use good judgment and not go and put yourself on numerous lists, because, as I said, it's making a challenging system even more inefficient when you have these spots where people just don't show up because they got their vaccination 2 or 3 weeks ago. Thank you.
En français, s'il vous plaît, Monsieur le Maire.
Yes. So I would like to ask the Ottawa residents to please not register at 10 or 15 different places, to 10 or 15 different pharmacies. There's a lot of frustration. This overloads the system. And is also very frustrating for the pharmacy workers. I would ask please to only register once. This will be much more efficient for the residents and also the other pharmacies. This way we will be able to vaccinate more people. Thank you. Thank you so much.
Go to Bruce Deachman at Ottawa Sun.
Hello, can you hear me?
Yes, we can.
Hello? Okay. A question for Dr. Etches about vaccination, and I'm wondering if you can just explain sort of the division and relationship of responsibilities and authority between the province and OPH. And I'm thinking of, in particular, this week the province opened up the hotspot postal codes to people ages 45 and up. And I understand that OPH can decide where it puts its pop-up vaccination, what neighborhoods it puts it in. I'm wondering if you have any authority, or have you lobbied the government to lower the ages in certain neighborhoods that maybe are not covered in those postal codes, or to lower them even more? I understand the government in a couple areas has ages as low as 16 or 18.
Sure. So overall, Ottawa Public Health is implementing a provincial vaccination program. So we're following the direction of the province in terms of how we prioritize different populations for vaccination, and the priority, to reach people at the greatest risk of hospitalization and death has been very important. And that's been a lot of older adults, and we see other groups at higher risk. And we are at a point now of, as we move down into the lower ages, being able to see that it's also now the people who cannot work from home that we need to reach as a priority. And so the approach provincially is the hotspot approach, and it's operating in tandem with our local approach. So the province through their hotspot strategy, is opening up postal codes in the provincial booking system now down to age 45, and that's useful for people to access. But we also know locally that won't be sufficient to reach people who cannot work from home and to support neighborhoods where they've had a greater burden of COVID-19 or they face more barriers to being immunized. And so that is where locally we use our data to identify where we need to go out with more of these other approaches Mr. DeMonte described. And so the province, again, has created parameters where we see the neighborhoods, they're overlapping with some of these hotspots, and so we're able to go down to lower age groups. And that does include, as the province has done, you may be most familiar with Toronto and Peel, where there are mobile clinics going into neighborhoods that they can go down to age 18 plus. And that is also our approach and our intention, where we have a mobile approach into a neighborhood. We are not having a barrier based on age. We are trying to be most efficient and reach people who cannot work from home across all the age ranges, and that is permitted under this hotspot approach, and recognizing also that the limitation here is the amount of vaccine. So we just still don't have enough to do everybody 18 plus in those neighborhoods. But this is our focus. This is what the Ottawa program, is targeting and seen as one of our measures of success will be how quickly we can protect people in the areas hardest hit.
Okay, and a follow-up, I guess, also for you, and you addressed this a little bit earlier, but the numbers, while still high, are coming down, and for most people who would just look at the dashboards and whatnot, it's encouraging. But you see other monitoring indicators. Wastewater is one that I know you've relied on quite a bit, and I'm just wondering how other indicators that maybe we're not aware of, how would you characterize how you're feeling about things?
I do want people to feel good about the hard work that they're doing. It is making a difference. It's really important. We've seen over and over, if we relax too much, the virus gets the advantage and it spreads more quickly, exponentially, and our systems can't handle that. So people should feel that we're on the right track. We are making progress. What I'm seeing is more of a stabilization in some of the indicators, like the wastewater, like the hospitalizations, and I'm hoping we can bring those more into a decline as we continue to be careful about that people we come into contact with, making sure when we do come into close contact with others, we're wearing masks. This will carry us through, even with the variants. These measures make a difference, and it will allow us to get that vaccine to everybody, because we know more vaccine is coming.
Thank you very much.
Thank you very much. Merci beaucoup. Who do we have from Radio-Canada?
Frédéric Pepin. Merci.
Frédéric, vas-y.
My first question is to Dr. ETCHES. Today, earlier, you talked about the sick day paid leave. You talked about the provincial approach. So we will have an answer from the province of Ontario this afternoon. How important it is to improve the situation, because in Ottawa, we have a good majority of the employees covered with a sick paid benefit. It is important to offer a paid sick day. Sometimes it's a very difficult choice. Sometimes the symptoms are not that severe, such as a headache or a sore throat. But we want to give to these persons the possibility of staying at home without losing their salaries. This will help them pay for their rent. So it is important to create an environment and allow them to stay home when they feel sick. So we still see people with these positive tests going to work. Many working environments feel the repercussions of that. Thank you so much. Follow-up question. It's for Mr. Watson. During the meeting today, you've talked about the short-term rental bylaw. Can you explain the importance of that bylaw, mainly with the recovery strategy within the City of Ottawa? So how would that invite visitors here in the city? Of course, we would like for them to use the hotel system in Ottawa. We have many rooms available. This will be the best solution. The hotels are paying a fee to Tourism Ottawa. It's very important to support them. But of course, the Airbnb platform and also started using a new system 2 to 3 years ago. So now people can rent their homes, can rent their apartments. But we wanted to impose a cap in the number of occupants, because it's not always a good experience for the neighbors. So let's say there's a hockey team with 25 players. They're coming in, they're renting one house. We will be limiting the number of occupants to 10 per dwelling. So if someone would like to rent a house or an apartment on Airbnb, it won't disturb so much the neighbors. Thank you so much.
To Sue Sharing on the city from the burbs. Sue, are you on the line? Okay, so this concludes our media availability today. Ceci conclut notre point de presse pour aujourd'hui.
This is all the time that we have. Thank you so much.